What unusual cell morphologies define rare leukemia types? Imagine peering into a microscope and seeing cells that look like tiny hairs, or cells with shapes so unusual they seem almost artistic. These distinctive appearances help doctors identify rare types of leukemia, which are less common but equally important to understand. Let's explore some of these remarkable cell shapes and what they reveal about these rare diseases. In hairy cell leukemia, the cells have a very unique feature. They display fine hair-like projections extending from their surface, which is why they are called hairy cells. These projections are short and resemble tiny hairs, making the cells stand out under the microscope. Despite their mature B-cell appearance, these projections are a hallmark feature that helps distinguish hairy cell leukemia from other types. Sometimes, a variant form appears that lacks these classic projections and shows different behavior, which can make diagnosis more challenging. The involvement of the bone marrow often causes fibrosis, which can complicate treatment. Another rare leukemia with distinctive cell shapes is T-cell prolymphocytic leukemia. The cells are mature T lymphocytes but tend to be larger and more aggressive. They have a high ratio of nucleus to cytoplasm, with prominent nucleoli that are easily seen. Sometimes, their nuclei are irregularly shaped, which helps pathologists differentiate them from normal T cells and other lymphoid leukemias. Large granular lymphocytic leukemia features lymphocytes that are noticeably enlarged and contain abundant cytoplasmic granules. These granules are azurophilic, meaning they stain readily with certain dyes, and are visible on blood smears. These granules reflected the cell's cytotoxic function, and the cells are larger than typical lymphocytes with a lot of cytoplasm, making them quite distinctive. Some acute leukemias display unusual cell morphologies that can be quite striking. For example, lymphoblasts may have a hand mirror shape with a polarized cytoplasmic extension that looks like a handle. Others may have nuclei shaped like cups with indentations or deep clefts. Cytoplasmic vacuoles are also common in monoblasts, appearing as large, clear bubbles inside the cell. Neutrophils sometimes show a pseudo-Pelger-Hewitt anomaly, with nuclei that are hyposegmented, giving them a rounded or bilobed look, often with needle-like hour rods inside. Additionally, some leukemic blasts develop granules resembling those seen in Shediac-Higashi syndrome, called pseudo-Shediac-Higashi granules. These unusual shapes and features often correlate with specific genetic mutations or subtypes, such as certain forms of acute myeloid leukemia that show cup-shaped nuclei and lack typical surface markers. Moving to megakaryocytic leukemia, the cells originate from megakaryocytes, the cells responsible for producing platelets. These leukemic cells often appear as small, sometimes binucleated or multinucleated forms, with lobulated nuclei and cytoplasmic projections or blebs. They may look like tiny versions of megakaryocytes but with abnormal features, reflecting their platelet-producing nature. This rare form tends to have a poorer prognosis and requires careful diagnosis. In summary, these rare leukemias are often defined by their unusual cell shapes and structures. Hairy cell leukemia cells have tiny hair-like projections, large granular lymphocytes contain abundant cytoplasmic granules, and certain acute leukemia cells may have hand mirror shapes or cup-shaped nuclei. Megakaryocytic leukemia cells show abnormal, often multinucleated forms with projections. Recognizing these distinctive morphologies is crucial for accurate diagnosis and understanding the biology behind these rare diseases. Always remember, if you or someone you know is dealing with leukemia, consulting healthcare professionals is essential for personalized diagnosis and treatment options.